Atlantoaxial joint is a synovial and pivot joint. It has diarthrotic and uniaxial. The atlantoaxial joint consists of the atlas cervical vertebrae 1 and the axis cervical vertebrae 2. The movement it involves is rotation of the head. The muscles included in the antoaxial joint include the sternocleidoid mastoid with a proximal attachment of the manubrium of the sternum and clavicle with a distal attachment of the mastoid region. The anterior scalene with a proximal attachment of cervical vertebrae and the distal attachment of rib 1.
Here you can see the sternocleidoid mastoid in the cat model and the anterior scalene.
The atlantoaxial joint is innervated by the spinal accessory nerve and spinal nerve C1 and C2 within the cervical nerve plexus. The ligament associated with the atlantoaxial joint is the transverse ligament, which maintains the articulation. Atlantoaxial instability is characterized by excessive movement at the junction between the atlas and axis as a result of either a bony or ligamentous abnormality. This instability can originate from congenital conditions, most common of which being Down syndrome. In adults, it is primarily seen in the setting of acute trauma or degenerative changes due to the inflammatory pannus of rheumatoid arthritis. In a person with atlantoaxial instability, the rheumatoid process affects the articular cartilage and the transverse ligament. The rheumatoid pannus and associated inflammation weakens the transverse ligament, thus causing clumsiness and incoordination of the neck pain, and head tilt.